Few of you guys already listened this session, and many of them they have the first session today. So, organon of medicine. This is the manual of homeopathy. Manuals means whenever we purchase anything, they give us a small copy to get information about that product. And after reading, we start working according to the instruction. This is the same thing in homeopathy. We have Hahnemann give us a tool, and he instruct us how to use this tool, and the manual is organon of medicine. Without reading this manual, we are not able to understand or use this book, this pathy, in a proper way. So, in the first aphorisms, Dr. Hahnemann says the physician high and only mission. Mission is always be a specific thing. This is not an ordinary thing. This is a specific thing. We have a specific quality to heal the person or the patient. This is our special quality. So we do three things in our practice. First thing, we cure the curable things, curable diseases. Dr. Hahnemann write it down in first aphorism and second aphorism. The cure, the physician high and only mission is to restore the sick to health, to cure as it is termed, and the highest deal of cure is rapid, gentle and permanent, and it's based on easily comprehensible principle. What are these easily comprehensible principles? These are, we have to give single substance at a single time. If you have a book, just open it and see aphorism number 272. So this was study in second session. So this is, you have to note it down, 272. So Dr. Hahnemann says, in no cases it is requested to administer more than one single simple medicinal substance at once. We are not allowed to give multiple remedies. We are not allowed to give formulas. We are not allowed to give alternation or the same medicine on the same time, both remedies on the same time in alternating condition. Because most of the times, if we have a fever condition, and I have seen many times people are giving aconite and belladonna at the same time to reduce the fever. But when we ask them why they are not giving single remedy, and mostly it says, this is the formula to reduce the fever. But in aconite, if you read Allen's keynote, Dr. Hahnemann said, we are never use aconite simply to reduce the fever. If you have a Allen's keynote, Dr. Allen says, never aconite used to be given simply to control the fever, never alternate with other drugs for that purpose, and if it be a case requiring aconite, no other drug is needed. aconite will cure the case. If the aconite is well selected and is the case of aconite. Very simple example. You have a person having a fever and you have to differentiate aconite and belladonna. And the person in sleeping condition, and you find out that you get the information, and the parents give you full information. Just do one thing and you will differentiate both remedies. Just pick the cloth of that person and see what is beneath of this cloth. If there is a moist heat, if you want to get more information or experiment on it, just see the vapors. Put hand over the vapors and feel that moistness. If the moistness below the clothes is there, this is belladonna. If the moistness below the cloth, this is belladonna. And if the skin is dry below the cloth, this is aconite. Only one example, and you can differentiate these both remedies. Dr. Hahnemann says, nobody, we are not allowing, in any case, you cannot administer more than one remedy. You cannot administer. And in aphorism number 273, it is not conceivable how the slightest deviation could exist as to whether it was more persistent with nature and more rational to prescribe a single well-known medicine at one time in a disease or a mixture of several differently acting remedy. If you take the case, if you analyze the case, if you have all the information of that case related and you find out the single remedy, then there is no chances to get 2 or 3 remedy at the same times. Otherwise, many physicians having their previous experience, that's why Dr. Hahnemann says in aphorism number 6, unprejudiced observer. Why? What is unprejudiced observer? Unprejudiced means when any person who have their previous experience and that person leave his previous experience to one side and concentrate what the patient wants to say in front of you and observe his activity, this is called unprejudiced observer. Prejudiced means when you use your previous experience to handle this present case. This is called prejudiced. Sometimes, before I get to that fever and I give them belladonna, and after getting that belladonna, that patient respond. But now you feel that this is a similar case and you can prescribe that belladonna too. But after prescribing the belladonna, you will not get any solution. You didn't get any answers. The patient didn't get any response, didn't get any relief. Now, your experience, you become biased. You are prejudiced. So leave that experience into one side, because the person sitting in front of you is different. His causation is different. His modality is different. His concomitants are different. Maybe the same remedy come after your case taking, but the circumstances are different for that case. Second, we palliate the incurable diseases. When the pathologies become so advanced, and what are the cases who are incurable. The cases who doesn't have characteristic symptoms. Any case with lack of characteristics, with lack of qualitative symptoms are known as incurable cases. So we have to palliate them. We have to give relief by palliation. And the third condition, aphorism number 4. The physician is not only the person who gives the remedies and wait. We are the preserver of health. We should know that what kind of things create diseases in the person. Dr. Hahnemann says in organon, aphorism number 4, he is likewise a preserver of health. And if he know the things that derange health and causes disease and how to remove from the person to health, then we can say that that person is a preserver of health. But we should know that what kind of things derange the health of person. And it started from the kitchen. If the physician should know about the kitchen of that person, he definitely improve that patient. Because the eating habits, mostly the eating habits make the person sick. It doesn't matter that person may be a small kid or the 80-year-old person. One person comes to you and says, "Oh doctor, I have a throat problem. Whenever I eat the curd, I face the same thing." And you says, if the curd is the problem for you, then leave it. Doctor, no. I cannot leave it. I know these things affect me. But whenever I get slight relief, I will get it again. And I again become sick. This is called childish behavior. The 80-year-old person who's having he see his life 80 year, but now he is or she is behaving like a kid. He know that thing derange him or her, but still he or she going to take it again and again and again and again. That's why we have to understand. We have to understand the kitchen of that person. Sometimes people are used to take very spicy foods and they have a hemorrhoidal problem. They have a digestive problem. Or mostly the people go out and they have a habit to eat outside. So we have to see them first. We have to check it out, the kitchen, and after that we can improve them. One of my teacher, he was always, whenever any case comes to them, any advanced pathology, he changed his whole diet first. He never prescribed remedy at the first attempt. Never. He wait for 15 days, change his whole diet, change his whole habits, and after that told him to come after 15 days. And mostly 80 or 90% people says we get a relief. Second thing, aphorism number 91. The symptoms and the feeling of the patients during a previous course of medicine do not furnish the pure picture of the disease. One person he experienced with many homeopaths. They give them multiple remedies. They give them multiple mother tinctures. They give them multiple mixed remedies, formulas. And after taking these formulas, they produce lots of new symptoms. But on the other hand, those symptoms and ailment which he suffered from before the use of medicine and after they had been discontinued for several days give the true fundamental idea of the original form of the disease. I have one case, the small girl, almost 10 to 12-year-old, and she was lots of eruptions on the head. The whole head having a large eruptions, having a bleeding from it, pus on the head, ear infected, bleeding from the ear, pus from the ears. And she was taking homeopathy from last 3 years. And that doctor gave them multiple remedies, more than 50 remedies to her. Repeatedly, 3 times a day. And she was getting worse and worse and worse. And she was recovered in 3 days. I just prescribe placebo and suggest her to take coffee for 3 days. In 3 days, she is recovered. No pus, no bleeding. And I prescribed my first remedy after 6 months. In 6 months, she was fully recovered. Only one symptom remained, the offensiveness. She is very offensive. And 200 Suriname, and till now she doesn't have any problem. Multiple remedies. One-sided, one person getting the lots of medicines and comes to you, and other side, aphorism number 207. When the above information has been gained, it still remains for the homeopathic physician to ascertain what kind of allopathic treatment had up to that day been adapted for the chronic disease. Any person comes to you and he or she is taking lots of allopathic remedies, allopathic medicine, Ayurvedic medicine, Unani medicine, and enantiopathic, allopathic, everything. Dr. Hannibal says, note down every single medicine that person already taken in their treatment. Note down everything. And find out which kind of medicine that person quickly taking, very repeatedly taking. And what protubing medicine have been chiefly and most frequently employed. And that person is taking painkiller very frequently. That person is taking antibiotics very frequently. That person is taking steroid very frequently. That person is taking antihistaminic very frequently. That person taking anti-allergic very frequently. Which remedy that person was taking? Note down everything and try to find out what symptoms produced by this allopathic remedies after that person already taken this. What is the difference between before and after? Note it down everything. And we have lots of remedies which can antidote. Last session we discussed about Ticurium marum verum. And mostly people think about Nux vomica. But Ticurium, any person who using multiple medicine, he was taking painkiller at the same time, he was taking antibiotic at the same time. He was taking steroids at the same times. Multiple medicine. But if the person is taking overdosing, Naxuamica. Overdosing and multiple remedies. Both are different things. And any lady who using contraceptive pills and having a habitual abortions, give her Nectar-Muriaticum. Nectar-Muriaticum is the remedy which give instant results in these cases. And in aphorism number 207, in order to understand in some measure and degeneration of the disease from its original state and where possible to correct in part this pernicious artificial operation or enable him to avoid the employment of the medicine. So I have one case is having a bleeding from the mouth, and that person was taking lots of allopathic medicines. He was using for medicine for high blood pressure. He was using for high cholesterol level. He was using lots of pain-killing medicines, antibiotics, and that all medicine he was taking from last 4 or 5 years, and says we have a tendency to get high blood pressure or high cholesterol level in my family. I changed the whole diet and told her to stop all the medicine. And now almost 4 months gone, no bleeding. Sometimes when we having a habit, because one term Dr. Hahnemann gave us, hypochondriasis. What is hypochondriasis? When any person are over conscious, over anxious about his or her health. I have one patient, whenever he call me, before calling me, he visit 10 to 12 doctors and do investigation from 8-9 labs to find out, is there any problem in between me? Is it a common thing all patient can do in this form? No. Very specific. And one doctor come to you, one patient come to you and says, oh, we need to investigate you, so you have to go for a blood test. Oh no, doctor, why are you taking these investigation? I don't want to go for the investigation. If you understand me, just give me a medicine. I will not go for an investigation. If you open the repertory, light shun. He don't want to go anywhere. And one person came to you, oh, okay, take this medicine and you will be okay. Doctor, do some investigation. I just want to know about what is inside me. Why I am getting sick. Two different language. And Dr. Hahnemann says it, disposition. Aphorism number 211. Disposition. And disposition is the only thing Dr. Hahnemann says, this hold good to such an extent that the state of disposition of the patient often chiefly determine the selection of homeopathic remedy. Chiefly. Absolutely necessary. When you stuck anywhere, the disposition of the patient will tell you what kind of medicine that person needed now. And as being decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. Accurately, when you observing, when you observe every single moment of the patient, you exactly see that patient disposition of the patient. So, three categories. Our mission divided into three categories. First category, to cure the curable things. Second, to palliate the incurable. And third thing, to preserve the health. We need to preserve the health. Few things, if you go more deep, what is the sole aim? Why we are here? Why we are sitting on the chair and talking with the patient? We need to form a pure picture of the patient. Complete picture of the patient. Complete picture. We need a complete picture. After 10 minutes, we will rest for 10 minutes and after that we rejoin this session again. Okay? Complete the picture. And when we complete the picture, we have to see aphorism number 84 to 104. 104. Where we trace the picture. Second, when we trace the picture, we have to give them medicine accordingly. This is law of similar. We have to give them similar remedy. And third thing, remove the whole disease. Inhalate, aphorism number 2. Inhalate the whole disease from its whole extent. Removal or inhalation of the disease in its whole extent in shortest, most reliable and most harmless way. Harmless way. So, these are our sole aim. Make a good picture. Then give remedy. Then remove the symptoms. And few things we are not need to do in our daily routine. The first thing, to make a false hypothesis. If we don't have any information, tell them. If you are not able to manage the case, directly tell them. Because I have seen many doctors who just prescribe the remedy because they are not able to understand the disease, they are not able to understand the patient, and after that the pathology goes beyond the level, they will say, oh, we are not able to do anything. But the patients get more and more worse. I have seen one case, the lady having a tumor in the breast, and the doctor says, oh, we will not go for the investigation. Okay, we will go for medicine. You have to take this medicine. After 2 years, the same tumor converted into the cancer. The case become incurable. And the big cancer, the whole almost 35 lymph node they remove in operation. Sometimes we are not able to understand because we don't have depth information, because we have lack of knowledge of practice of medicine. And mostly we say, oh, why we need to read practice of medicine? If we are we give that symptomatic treatment. Practice of medicine is very necessary for us to understand the disease, what is going on inside. And last time I discussed, sometimes we are not able to understand the characteristic and the simple formula. Read that case, sit with that person, write it down, all the pathological symptoms of that person in one side. Read practice of medicine. If these symptoms belong to practice of medicine, these are the common symptom of disease. For example, one person comes to you with the hypothyroidism and he says, "Oh doctor, I have a rough skin, I'm very chilly, I'm getting obese." And you will find out that these are the common symptoms of hypothyroidism. These symptoms will present in every hypothyroidism case. TSH level high. But accept anything which is not written in practice of medicine is belong to that patient. Belong to that patient. Doctor, whenever a few days before I got this information about hypothyroidism, I'm shocked. How this happened to me? This is not possible. And look at this, my reports. I cannot believe it. Another patient says, "Oh doctor, I feel that I have this problem before, but I will not go for investigation. I will not go for anywhere. I didn't meet anything. And then why you come now, doctor? Now my sickness increase. And I feel that if it is more increase in future, so I have to stop it now." If you open the repertory, there is one rubric, fear of extra vengeance. The disease, until he didn't get any trouble from disease, he was okay. But suddenly that disease giving her sickness, suddenly he feel that this sickness make me sick, more sick. Then he decide to go for the doctor. And opium is the single remedy there. If you see in Kent repertory, opium is only one remedy. We have to avoid hypothesis. We have to make us strong. We have to make strong base for every prescription. That's why continuous reading, continuous discussion give us opportunity to learn more things. Then, deceive the patient with mere talk. Aphorism number 1, footnote. Aphorism number 6, footnote. In 6 footnote, how it was, and you will see many, if you see in patient in Facebook, it says, "Oh doctor, I have a abdominal cancer, can you suggest any medicine?" And lots of people are giving medicine, telling medicine, you take this or that. Dr. Hahnemann says how it was possible for a physician at the sick bed to allow themselves to suppose that without most carefully attending to the symptoms and being guided by them in the treatment they ought to seek and could discover only in the hidden unknown interior. How it is possible to, without taking the whole case, you can prescribe the remedy? Is it not possible? You have to take the care. You have to understand the characteristic of the patient, because every single person is different and every single causation is different. Every case is different. Next, quality. What kind of quality one physician should have? It doesn't matter you are an allopath, doesn't matter you are a homeopath, you are Ayurveda, Unani, any type of naturopath, any type of doctor you are, but you should have these quality in you. And Dr. Hahnemann says, unprejudiced, you have to leave your previous experience to deal with present condition. You have to leave this idea. You have to leave this experiment with the patient. These all things are give us to remembrance of the medicine. Sometimes we see that patient, and sometimes we have experience with that medicine, and we remember the particular case and the symptoms. So in 30 seconds, the meeting will close automatically, and after that, 10 minutes after, we will come in 10 minutes. Join me again. Thank you. And second thing, if the person is unprejudiced, he should be intelligent. He should be intelligent. And if you see aphorism number 7, especially footnote. So in aphorism number 7, doctor talk about causation. It is exciting causes or maintaining causes. If these are exciting and maintaining causes, in footnote, Dr. Hahnemann says, it is not necessary to say that every intelligent physician would first remove these causation. It doesn't matter it is exciting or maintaining cause. He should remove it first. And he will remove it first, because these exciting and maintaining cause are the biggest obstacle to cure the sickness. Third things, the physician should be accurately observing physician. Aphorism number 14. Aphorism number 14. There is in the interior of man nothing morbid that is curable, and no visible morbid alteration that is curable, which does not make itself known to the accurately observing physician. If you guys are observing, if we are accurately observing the patient, then we definitely get all the information about the sickness. And we know that whatever is coming out in the form of sickness, in the form of sign and symptom, is the outward manifestation of internal disease. Internal disease. And if you read aphorism number 141. Dr. Raksha, can you open your camera, please? How we can become accurately observing physician? How? Dr. Hahnemann give answer of this question in aphorism number 141, footnote. Doctor says, those trials made by physician on himself have to for him other and inestimable advantage. If you are doing proving on yourself, you will get extra advantage. In the first place, the great truth that the medicinal virtue of all drugs, whereon depend their curative power, lie in the changes of health he has himself undergo from the medicine he has proved, and the morbid state he has himself experienced from them becomes for him an incontrovertible fact. If you observe yourself, for example, we did not do any proving, and we have always in doubt he is telling true or not. And we are not understanding what kind of sensation that person feel now. If you prove yourself, if you prove medicine, you will having a habit to observe yourself, your symptoms. What kind of sensation you have inside? What kind of sensation these medicine produce inside you? And this is only, and even though if you have any bad experience with the medicine, you will never forget rest of your life. You don't need to read it again from the book. You definitely remember this. And I give you a small example. Anything happened in your childhood, any sickness, any eruptions, any bad experience of hospital, any injection, any wound, if after 60, 70 years after somebody asked you about, hey, something happened in your childhood, and you say, yes, one time I get very sick and my parents admit into the hospital. You never forget. And why Hahnemann having a vast knowledge of materia medica? Because he himself proved 90 medicine. And he know that how to compare what kind of medicine, what kind of medicinal substance produce what kind of symptom in the body. And again, by such noteworthy observation on himself, he will be brought to understand his own sensation and his mode of thinking and his disposition, and he will be also trained to be what every physician ought to be, a very good observer. Then we become a good observer. Then we will see whatever the other physician not able to see. Then we will see how arsenic, how phosphorus, how pulsatilla, how minerals, how plants, how no sort act in the body. How they produce symptoms. What kind of symptom produce first and what kind of symptom produce after. It make you more accurately observer. By means of morbid sign and symptoms, an arrangement in perfect conformity with the infinite goodness of all wise preserver of human life. Next is when carefully observing and investigating physician. Aphorism number 16. Last 4 lines. So that it is only by the dynamic action of the vital force that remedy are able to re-establish and do actually re-establish health and vital harmony. After the change in health of the patient cognizable by our senses. Our senses. The person will understand, the person will feel that I'm feeling better. What is feel? He sensation himself that I'm feeling better. And one thing more, if you have a Bogle repertory or a Bonninghausen repertory, Bonninghausen give a very wonderful characteristic symptoms rubric, and you can find it in Pathak repertory. Prodromes. Prodromes. One person says, doctor, I feel that I will get the running nose in the evening. I feel that I have a fever. I will get the fever in the evening. I'm feeling that my throat having something, and I feel that I will get sick in the morning or in the evening, or my throat will be will hurt, and I feel that something bad is going to be happened. This is called prodromes. And if you read Intermittent Fever book by Allen, he give many times the prodrome symptoms. Feeling of tiredness before the fever. Feeling of loss of appetite before the fever. Feeling of pain in the body before the fever. Feeling of heat on the face before the coryza. What is these? These are prodromes. These are the symptoms which are produced before the condition comes into actual situation. So these are called prodromes. And Dr. Hahnemann written in aphorism number 16, vital harmony. After the change in the health of the patient cognized by our senses, the totality of the symptoms have revealed the disease to the careful observing and investigating physician as fully as was requested in order to enable him to cure. So we need to understand the whole case through sign and symptom, what we observe, what we understand. Then, attentive, observing and investigating physician, aphorism number 254. The other new and increased symptoms, or on contrary, the diminution of the original one without any addition of new one, will soon dispel all the doubts from the mind of the attentively observing and investigation practitioner with regard to the aggravation and amelioration. One person. And I give you one more example if I get the...
Can I ask a question?
Yeah, sure. Yes.
Can I ask a question?
Yes.
What did you want to say about the prodrome symptoms?
Prodromes are the sensation.
No, I know what they are, but is there something that you wanted to say about them, or you just say what they are?
No, I just explain it, what they are.
Okay.
Yeah.
Okay.
So, accurately observing, one person comes to you and after taking medicine, the symptoms reduce, and you will see in many cases, any small kid or anyone who having a running nose after taking the medicine, allopathic medicine, the flow suddenly stop. And after suddenly stop, the patient complained of nasal blockage. After nasal blockage, they gave us nasal spray. After a while, you can sleep properly. And in the next attack, you says, now my nasal cavity and the behind, the posterior nasal are also involved. And after that, you take the medicine, they become reduced. And after that, your throat involved. And then larynx involved. And then chest involved. The patient, anytime when these symptoms are reoccur, they reoccur in intensity. Now, the problem goes from small, less important to more important organ. The problem is in lungs. The person is not able to breathe, not able to sleep. So this is the duty of attentively observing and investigating physician who should know that what kind of pathology and how that pathology occur in that person, what kind of suppression, what kind of treatment he has taken already. Then observe the disease manifestation, aphorism number 14, and function of the part of organism exposed to his senses, aphorism number 11. When the person falls ill, it is the only spiritual self-acting vital force everywhere present in the organism that is primarily deranged by the dynamic influence upon it of the morbific agent inimical to life. And it is only the vital force deranged to such an abnormal state that can furnish the organism with disagreeable sensation and inclined to be irregular processes, which is called disease. This is here Dr. Hahnemann tell us about the disease. And if you open aphorism number 149, yes, 148. This is what Dr. Hahnemann explained about the disease in aphorism number 11. And if you read 148, Dr. Hahnemann here talk about natural disease. The natural disease is never to be considered as a noxious material situated somewhere within the interior or the exterior of man. Aphorism number 11 to 13. But as one produced by an inimical spirit-like conceptual agency, which like a kind of infection. Note 2, aphorism number 11. Disturbed in its instinctive existence to the spirit-like conceptual principle of life within the organism, torturing it as an evil spirit and compelling it to produce certain ailment and disorder in the regular course of its life. And this is known as symptom. This is known as disease. Regularly, one person regularly getting these symptoms. Then, observe the state of disposition of the patient. Disposition, I already talked about disposition, aphorism number 211. This holds good to such an extent that the state of disposition of the patient often chiefly determined the selection of homeopathic medicine, homeopathic remedy, chiefly the disposition of the patient. Then attentively you are listening to the patient, what he wants to say, aphorism number 83. The individual examination of the case of disease, for which I shall only give in this place general direction. general direction of which the practitioner will bear in mind only what is applicable for every individual case, demand of the physician, nothing but free from prejudice, free from your previous experience, free from what kind of case you are dealing with in past. But here you need unprejudiced, sound senses, attention in observing, because your one ignorance, you will lose the characteristic symptom of the patient. Characteristic. We will lose the characteristic. And fidelity in tracing the picture of disease. Then, having sound senses, perseverance and penetration, aphorism number 216. Perseverance, he should be laborious, aphorism number 149. Footnote, this is very important footnote, and everyone should print it out and put on the wall of your clinic. But the laborious, sometimes very laborious, search for and selection of the homeopathic remedy most suitable in every respect to each morbid state in an operation which, notwithstanding all the admirable book for facilitating it, still demands the study of the original sources themselves, and at the same time a great amount of some circumspection and serious deliberations, which have their best reward in the consciousness of having faithful discharge of our duty. Once we take the case, we have to read it, we have to analyze it, we have to see what grading, we have to give grading of the symptoms, we have to see the Kent 12 observation, we have to see the Hering's law of cure. And how could this laborious, care-demanding task, by which alone the best way of curing disease is rendered possible, please the gentlemen of the New Mongrels Act? We are not able to. We are giving formulas, we are giving multiple remedies, we are giving unnecessary mother tinctures, because we are not able to understand the case. This is because we are giving these remedies, these medicines. Then, free from indolence. If you are not, this is the preface of first edition. If you see preface of first edition, and Dr. Hahnemann says, any person who loves, who is indolent, who is love for ease and obstinacy preclude effective service at the altar of the truth, and only freedom from prejudice, untiring zeal, qualify for the most care of the all human occupation. We have to leave, we have to come out of box. We have to read it again. We have to discuss. If you don't know, accept it. We don't know anything. Discuss it, because discussion give us more clarity in the subject. Discussion will give more clarity on symptoms. Discussion will more clarity on how to take the case. Now, we take the case, and Dr. Hahnemann says what we have to see in the case. Aphorism number 153. This is the duty of every physician, especially homeopathic physician, to see the aphorism number 153 in every case. What is 153? In search for homeopathic specific remedy. This is to say, in the comparison of the collective symptoms of the natural disease with the list of symptoms to non-medicines in order to find among these an artificially morbific agent corresponding by similarity to the disease to be cured. The more striking, the more singular, the more uncommon, the more peculiar characteristic sign of the symptoms. And I'll give you a very small example. I have small kid, 7-year-old. He has abdominal pain every time when he eat. After some time, he has a abdominal pain and he has to vomit it out. And when the ultrasound, the doctor did ultrasound, they find out that the person having a large accumulation of stool in the large intestine. Transfer colon, there are lots of stool there. And one day he was sitting along with me and he was eating. Suddenly he says, I have an abdominal pain, and suddenly go to the washroom and vomit out in a single attempt everything. Come back, start eating again. Very characteristic. And if you have a Allen's keynote, see Ferrum metallicum. Ferrum metallicum. Vomiting immediately after midnight, immediately of ingesta, as soon as food is eaten, leave table suddenly and with one effort vomit everything eaten, can sit down and eat again. Immediately. Very characteristic. And this is the case of constipation. Is it possible? Is this condition is present in every constipation? No. This is very characteristic and it is belong to Ferrum metallicum. Striking. And the condition which make you shocked. How this is possible? One person having abdominal pain and nobody will come back and eat it again because he has experience after eating this person having a abdominal pain. But he is eating. And one more thing, he is constipation because Dr. Allen gave answer to it. Constipation from intestine atony. The movement of the intestine was very slow. That's why the amount of stool is collected into the transfer colon. Atony of the, and after 4 or 5 days, he passed all the stool and the whole intestine was clear. Carefully investigation, aphorism number 81. Then, very important thing, very important aphorism of Dr. Hahnemann, what we need to understand if we are dealing with chronic cases. Aphorism number 5. Last 6 lines. In these investigations, the ascertainable physical constitution of the patient, especially when you are dealing with chronic case, his moral and intellectual character. And most of the homeopath don't know about what are the moral and what are the intellectual character of the patient. And if you guys want to read, just purchase the Allen's Encyclopedia. This book differentiates the mind into intellectual and moral characteristic and emotional characteristic. It divides into 3 parts: emotional, moral, intellectual. And we definitely differentiate These characteristics. And these are very, very important for every physician to understand the characteristic moral and characteristic intellectual character of the patient. We have to differentiate. Then Dr. Hahnemann says moral and intellectual character, his occupation, mode of living and habits, social and domestic relation, his age, sexual function are to be taken into consideration if you are dealing with chronic case. Aphorism number 5, exciting and the fundamental causes. And it differentiates in two parts, acute condition and chronic condition. And the condition which repeatedly come again and again and again. You give medicine, patient become okay, and after that while the patient become sick with the same condition. And you can find it in the small kids. Regularly they become nasal congestion. Regularly they become sick, and whenever they're sick, the respiratory involved. And we should know that the aphorism number 3, knowledge of the physician, knowledge of practice of medicine, knowledge of drug proving, knowledge of how to make doses. Aphorism number 269 to 272, mode of preparation of homeopathic medicines. Then aphorism number 272 to 274, we have to give single medicines in every single case. And we have to read aphorism number 275 to 278, strength of the doses. Strength. What potency, how to make doses, how we can repeat the doses, what amount we need, and law of similar, law of proving. Proving is 105 to 145.
Can you repeat, please?
Proving 105 to 145.
Thank you.
And finally, if he know the obstacle to recovery in each case, he should know about the exciting causes. He should know about the maintaining causes. He should know about the indisposition. If we need to prescribe the remedy or not, the person needed that remedy or not. This is the only thing we have to understand. And repetition of the disease, of the medicine, and the thing that maintain the disease, aphorism number 4, and disturb and endanger the health, and how to remove them. This is aphorism number 4. So this is all about today's session. So I try my best to give all information, whatever we need to understand only one thing, mission of the physician. Just one thing. What is our need? What is Hahnemann demand from us? Hahnemann demand for regular work. Regular work, regular discussion, regularly if you are reading the books, the original books, especially the original book, because now in market, lots of things, people are copy pasting the old material and make the new book and says we are the author. No. Original book, original work, if you have patience, and if you see something different, write it down. I see this. I see, for example, I give you a intestinal constipation case. I have seen this and I didn't take this case. I just see and give medicine. So That's why I need observation. That's why we have to concentrate more on observation. Observe the patient. Sometimes we need 7-8 days in just observation. How that patient, sometimes the person is not behaving what he actually is. So we have to take patience. Patience is also necessary for here. So next session, we are already discussing about the case taking, and I will read all the aphorism what we need to understand before case taking start. So hope so it gave you a strength, more strength to read more in organon of medicine, because this is very necessary for everyone. So I will take